I was in I was in the 12th event for the season. It was an ultra event. It was a 35-mile ultra event, and I jumped over a tree that was across this little path, and I only had one way to fall, and that was down a ravine. And that's how I injured my knee, and I knew at that time that I was going to have to do something about it.
About 2 years ago, I met a man, Richard Burke, an ultra-marathoner, long-distance runner, who had some knee problems for a couple of years. Prior to seeing me, he'd seen another orthopedic surgeon.
I started looking and talking to some orthopedic surgeons, and most of them appeared to have really good references, but then when I spoke to one or two of them, the first thing that they would say, they understood that I was an athlete, but I was not going to be able to run. They would never recommend it or allow it.
He was referred to see me, see what his options were. We took new x-rays and got a new MRI and evaluated his knee and tried a couple of different things.
So we did some cortisone shots and so forth, but that lasted very, very little time. It would only take care of me for about maybe 4 or 5 months.
And so we talked about joint replacement. And I was somewhat hesitant to recommend that initially because I knew that he wanted to run long distances, which is typically not recommended following joint replacement surgery.
And I didn't want to hear that, and because that's how I define myself. I'm a runner more than anything else.
I knew that no matter what I told him, he was going to return to running. So we chose a type of a knee replacement called a patient-specific knee replacement, where we used information that we had obtained from an MRI, and we built some of the tools prior to his surgery that were specific for his knee. And those tools were used during the surgical procedure to perform the most accurate, precise knee replacement possible for him.
The majority of doctors that I have visited had all told me that I wasn't going to be able to run again. And that's not what I wanted to hear, and I didn't believe that. I truly believe that I know that there is a way. I've done so many other remarkable things just with the distances that I ran that I would have the ability and the determination to make sure that I could run.
What we did for Richard is what I do for every patient, both before and during surgery and after surgery. We use those patient-specific implants on everybody that we can because we've had such good success with them. I think that Richard's case differs from some patients' cases in that I had to slow him down after surgery as opposed to motivate him because he was so eager to get going. I didn't want him to do too much too soon. So most of his clinic visits were spent educating and discussing.
I have so much flexibility. I wake up sometimes not realizing that I have a knee replacement. There are times when I'm running that I can feel it, but there's other times there's more and more time goes by that I forget that I've had a knee replacement. So it's just really great.